by analyzing the positive test rates over a period of time. So you're going to describe. So you get the results of, how many of them have HIV positive, how many of them coronavirus positive, that kind of data. Diagnostic, it is purely based on the symptoms. Suddenly you have headache, cough, diarrhea. It also tells you a lot about that. So this symptoms, if you record it, it becomes the diagnostic analytics. The third one we discussed yesterday, that is predictive analytics. Predictive analytics is all about forecasting the spread of the seasonal disease. This year, are we going to experience malaria? Last year, same month, in the month of May, we had other diseases. Are we prepared for this year diseases? Those details are dealt. Looking at the historical data, you are predicting or forecasting the future. That is the predictive analytics. The last one is prescriptive analytics, which is very useful because you are trying to assess the patient's risk. What kind of risk factors that the patient have, and then implementing specific preventive treatment plans. So patient to patient, it would differ. If you look at predictive, diagnostic, and descriptive, they can be general, but prescriptive can be very specific because this would differ from patient to patient, right? That's exactly what we said. Descriptive, diagnostic, predictive, prescriptive, and there is also another thing, the fifth one, if you look at this one that I'm trying to highlight, is the discovery analytics as well. So descriptive analytics, you categorize, you characterize, you aggregate, you classify the data. So you're doing all kinds of classification, cataloging, and aggregation. You try to sum them up. And whereas you try to make decision based on some statistics, including performance and results, so on. Diagnostic analytics, if you look at it, it explores the data, discover the root causes of the problem based on the symptoms, right? And it also tries to identify an influential factors impacting the performance. So why certain things are leading to different kinds of outcomes or the performance. Predictive, as the name suggests, always uses the past data to predict the future. That's the important part. I can put that in the chat box just to re-ensure that we all are on the same page. I'm referring to predictive. Predictive is used by many hospitals today, including the Government of India, including WHO, NMC, the National Medical Council. This analytics uses past data, historical data. So this historical data will be able to forecast the present or the future. Remember this. So it's a lot to do with prediction. How do you predict whether it's going to rain this year? Last year it rained, so hence it can also be raining this year. So the past year data, history data will be helpful to take care of it. That's why we have them. So we now again go back to the PPT and try to look into it. This is what it is. Okay. And then you have prescriptive. Prescriptive is about the decision making. The decision making that you have. What is the decision making capacity? By providing the best course of action. So, what medicine is suitable to the patient based on the risk factors of the patient? And then it's also about, are there any things? Have you ever heard uh, doctors asking, are you prone or are you susceptible to antibiotics? Doctors asking patients that, uh, do you have any allergy towards certain medicines or certain foods? That is a very specific question to the patient because it is coming from the prescriptive analytics. We have dealt these four in the last couple of days. Yesterday and today we are dealing with it. This is a new one. It's called the discovery analytics. Discovery analytics, as you know, is all about discovering new knowledge, something that you have got it, something related to medication. New treatment has come. Cancer has got a new treatment. Cancer has got a new medicine. Okay, and you also find out maybe a new symptom that has come up. It was not known. This is a discovery, and you are trying to extract wisdom from the data. So you will do a lot of data mining, you will filter, you will try to skim the data, and then you do the transformation. So among these five, tell me which one is more suitable to your organization and why. Anybody? Hello, just tell me. You can also respond. I'm saying that there are five different types of healthcare analytics. Among these five, which one you think is more applicable to your organization and why?
I think diagnostic analytics.
Why? Why do you think so?
Mm, because to find out the root cause of the problem.
Hmm. Yeah. So in your organization, in your place of work, you use a lot of diagnostic analytics.
Yes.
Okay. Do you record their symptoms? Where do you record their symptoms? Or you just record it on the prescriptive, paper and give it to the patient itself? You may not have anything. Or do you also have one copy with you?
Yes, we record it, sir, in record, in medical record.
Okay. So you're also recording the symptoms as well.
Yes, sir.
Okay. And that will be there in the patient record. So
Yes.
it goes inside the medical record. Okay.
Yes.
And do you refer it back? How often you go back to the same sheet whenever you're prescribing or you're changing the medication?
Yes, while prescribing and while coming to a decision for the treatment.
Hmm.
Yes.
Okay, that's wonderful. Great insight. Thank you, Nivedita, for this. And anybody else? Anybody? Some thought on any of the other analytics? See, analytics is all about how do you manage the data. Every day, hospitals and organizations which are dealing with the healthcare, they produce the data. What are you doing with that data? Are you really helping the patient to reduce their pain and also to reduce the cost? What kind of help that you are extending through this data? This is a rich wealth of data, processed, unprocessed, structured, unstructured, but lot of majority of the hospitals, they generate data. This generation of the data can be of great help, not just to the existing patient but also to the patient who are going to come. Based on this record, like Nivedita mentioned about the diagnostic analysis, trying to find out the root causes of the problem. Once you know the root cause of the problem of the disease, then prescription becomes easy. Whether that prescription works or not, again, you have to do some kind of other analysis. Everything is data in medical science today. Remember, you are operating, you may not be knowing it. You feel that I am writing some 4 5 medicine, I'm asking them to take morning, afternoon, evening, but that is the data you are prescribing. Your prescription is a prescriptive analytics. Your recording of the symptoms is a diagnostic analytics. Whatever that you do with the patient is a data driven thing. Data is the new currency today. You can have an exchange value for it. It has got its intrinsic as well as extrinsic value. Please do remember that we are not talking rocket science here, and we are not really bringing very complex statistical tools or techniques. We are looking the data at a very holistic position, or from a point of view where you can call the shots, where you are a decision maker, where you are a strategist. If you are running the hospital and you are the proprietor, you are the owner of the hospital, and you would like to know how many patients actually come. What is the footfall? If there are 100 patients coming to a clinic, how many of them have common problems? Or how many of them are coming for specific problems? Which department gets more patients? Is it the neurology department? Or is it the cardiology? Or is it the gastroenterology? Or is it the endo or Andromeda? Anything, whatever that is there, and your hospital must be specialized. So you have super specialty hospitals. So there are different departments that you have. Okay, just the snapshot of this will help you to move on. Then look at the labels of the healthcare analytics: operational analytics, tactical, and strategic analytics. Let's spend some time together to understand operational. As the word operational signifies that it monitors the basic performance indicator in daily operations. How wonderfully, how efficiently, how with ease you are able to take care of your daily operations. There may be some 100 smaller bigger operations that you are doing, not the surgical operation, right from patient who comes along with the attendant, sits there for the appointment, how easy that process is being followed. How much time does it take for a patient to get a consultation with the doctor? So if someone says that I am number fifth, so how much time should I wait? Are you able to give that answer? You will be able to give that answer. You say that each patient, on an average, roughly, the doctor is taking 20 minutes. Sir, your turn will come after an hour and 30 minutes. You might like to wait, or you can come back if you do not have patience to wait. So operational analytics would also give you a lot of visualization for the routine situation. Visual representation of the data is very good. So there are lots of statistical applications today. They are available. There are a lot of apps that will give you, even an Excel gives you visuals, we like pie chart, pie diagrams, and then you have bar charts. You also come to know that, okay, this is how the graph looks like. You have the facts and figures in the most easy way to understand it. Pictorial, graphical, visual representation of the data is much easier than the written part of it, because the data needs to be visual. The more visual, the more appealing that's going to be. That is about the operational analytics. The next interesting aspect of analytics is the tactical analytics. Tactical analytics deals with the management in handling visible problems and achieving longer term objectives. So, what are some of the longer term objectives of the hospital? Let's say the footfall of the patient. How are you managing it? If you happen to go to Gandhi Hospital, Usmania Hospital, you have to have, there is a footfall of the patient, and it's a public hospital. That means it's a government hospital, and they are mandated to serve the public. So how are you able to handle it? So there may be less number of beds, there may be less number of doctors that are available. Each one of them might be seeing some 20 patients every day, enormous amount of pressure, right? How are you able to fulfill those longer term objectives? That's one part of it. The other part of the tactical analytics is the simple predictive model based on the past performance. It also uses the past performance. How did you manage it last time? And can you manage it now? So, if South Central Railway during Dasera, Diwali, Sankranti, and summer rush, they call it festival rush, summer rush. How are they able to get special trains on Hyderabad to Kakinada, Secunderabad to Machilipatnam? There are trains being run, or Secunderabad to Bhubaneswar, or Secunderabad to Patna, Varanasi. How are they able to get that? Based on the past performance. Similarly, in the hospital, coming back to the example of the hospital, as far as tactical analytics are concerned, so you will use simple predictive models, predicting how are you able to forecast from the past data about the future. Okay, so in the last monsoon season, there were 3,000 cases of malaria in our hospital. We expect during the monsoon this time, there will be more or less going to be the same numbers, 10% here and there, or maybe more. Because if the monsoon goes really out of hand, then it's tough. That's one. What about the strategic analytics? Strategy means long-term planning. How are you going to achieve that? So it's affect the organization's direction. Where do you want to go? Where is the most important direction of the organization? Where do you want to see your organization going? Are you going to acquire few more hospitals? Are you going to expand it? So which is the number one hospital in Hyderabad? Anybody? Are you all there? Basic question. Guys and girls, please tell me. Sabita, Monica, Nivedita, Simi's Joy. Which one?
If it is government organization, it is NIMS.
Okay. Why not Gandhi?
Uh, because I think specialties are more in NIMS.
Okay. Fair enough.
Specializations, I mean.
Yeah. So would they
Yeah.
not like to open one more branch in some district in Nizamabad or Adilabad or maybe in Warangal? What is the mandate of them? Or even people living in Adilabad, Warangal, Karimnagar, they have to come to NIMS. Is that the way? Or
Mm,
if you look at the private hospital, are they looking for expansion? Star hospitals. Sunshine Hospital has joined or merger and acquisition with KIMS Hospital.
yes, yes, they are expanding, but not in rural areas.
Yeah, so that is their priority, that is their strategy. Mostly in
Yes,
the urban pockets, they want to expand because people who are able to pay, they live more close to urban cities and
urban.
towns,
Yes.
urban areas. So that's a strategic analytics. So strategic analytics is usually for the proprietors, is usually for the top executives, top management. Top management will have this data. This data may not be available to the workers, may not be available to the other, employees. Largely, this is for the top management, owners, proprietors, directors, executives. They are the ones who carry that data because they are going to take the strategic decision. They will take into direction. Should they tie up? Uh, you heard of Kamineni has joined hands with Wokhard sometime back, and now that the
Yes,
whole,
sir.
yeah, so that association is now being collapsed. It's no more association. So Bombay Hospitals, Wokhard Hospital has joined because Wokhard cannot come with their infrastructure to Hyderabad. So the existing hospital in Hyderabad, they have joined hands. So they can have this collaborative effort. That was a strategic decision. And then if you feel, you can even join hands with, Hopkins Hospital, American Hospital in Hyderabad. So you can have Harvard Medical College coming and helping KIMS, coming and helping others. So that's a strategic analytics. It's very complex because it uses a lot of systems and disciplines. It's not easy. Others may not be able to understand because you have no information about it. You have no source of data. Only the proprietors, the top executives will have that kind of handling. The owner of the hospital might know about it. where I want to take the hospital to, which next level. Expansion is one. Within the same location, I want to have more and more. And I there was no oncology department. I wanted to have an oncology department. Earlier, it wasn't there. Dental or dentistry wasn't there. So I also want to include everything under one roof. Everything is there. Why do you want to have so many? Like uh, one of you mentioned, NIMS in the government sector has got more specialization. So that's a strategic decision by the government to have more and more specialization at the same location. Okay, let's move on and look at the future impact of the healthcare analytics. Uh, any idea about epidemiology? What do you do in epidemiology? I mean, this word was quite useful in or during the COVID times. How do you know, take care of? We can even go to let's visit. I'm just going to go. All right, give me a minute. I'll stay on the screen. We'll try and look into a WHO epidemiology data that we can have it. We can even have it. Where is that? WHO epidemiology. Okay, let's see if they were able to bring this data collection. There we go. Uh-huh. So how about the World Health Organization manages and maintains that data? So they are, bringing this thing, non-communicable diseases profile. Look at this visualization, HIV laws and policies and so on. So malaria country profile. Let's go here. This is a very, oh, this page doesn't exist, but should be able to have because it's an old page. Okay. I wanted to have maternal mental health atlas. Somewhere tuberculosis is also okay. I mean, there is some data that is there. Uh huh. So country wise, this is a visualization. Can you see the visualization? You get the visualization. Yeah. So let's wait. Mhm. Yeah. Now this is country wise. Let me go. Uh, I don't know how many of you are on laptop, but otherwise you could have done this. I can also provide you the link. Let's put that link here, and you can even see it. If it is not visible on your phones, then you can look at it. We'll go to India. Yes, India is here. There you are. This is the one. Oh, so total TB incidences. This is the number that you have. Rate per 1 lakh population, 100,000 population. It's 200 roughly. Okay, HIV positive TB incidents, it's 3.5. Okay, MDR and so on. This gives you the population wise. Is it reducing or is it going up? Looking at the visualization. Anybody? There is so much of data here, right? Age group wise. Who has got more, you know, cases, males or females in the age group? What about 15 to 24 age group? Who has more cases or incidences? Can you see this? Can you all see this? Hello.
Yes, sir. Yes, sir. We can see.
Yeah, now tell me from this data, I'm here. So there are two colors, the males and females. Now tell me in which group, age group on the vertical column, You have over and above 65 age, and you have 0 to 4. This is what it is, increasing order: 0 to 4, 5 to 14, 15 to 24, 25 to 34, 35 to 44. This is the age group, and this is the data,
Yes.
right? Now tell me, in which age group you see there are more females who are actually suffering, or who have got more cases than their male counterparts.
15 to 24.
Yeah, so look at, how do you say that? Because look at the color, you say, hey,
Yes.
it's here, right? The visualization, that's the beauty of the data, you know. It's not just numbers, but the numbers can be represented in the visuals. The visuals can be very colorful, and it's easy to present before anybody. The same data, but visuals will go up. Look at here. Some of the cases attributed or attributable to 5 risk factors. This is for the year 2022. So 2 years back, what are the factors that were causing more to TB? If you look at it, undernourishment
Mm.
was one, alcohol use disorder, contributing, smoking, diabetes, HIV. Look at that. And what about funding? Because you need to have lots of fun. So, where is the funding for the TB coming from? In one short, tell me, or in one word.
WHO? Is it?
Yeah. So mostly, if you look at the color, the domestic will have. So local NGOs or government or other bodies are doing it. International funding, you did have it, but
But
international funding,
not.
the international funding has also reduced. In 2021, perhaps you got more international funding, but
Yes.
in 2022, the international funding is reducing. What could be the reason for international funding to get reduced in 2022? Any idea? Looking at it, because of the FCRA. So you have this foreign, you know, contribution regulatory act. It's very, very tough to get money unless you are under the lens of the organization. So many of the organizations which were receiving international funds, their licenses were seized, or they could not renew because of the FCRA. So if you don't have uh, the license, then you may not be able to do so. That's the thing that you can do it. This is one example of it. You can always go back and get all the details. Everything has been given in visual representation: financing, treatment, and so on. This is also another thing. Look at this one, the interactive part of it. It says, and it uses the Power BI. Power BI is a software, it's an app. It gives you, right. Now, this is the diagnosis, notification, and treatment of rifampicin resistant, that is TB. Uh, so you have data from 2009 to 2020, and you have the treatment success. Treatment success is going up, and failed cases are also reducing. In 2020, the number of failed cases are less. People who died are also reducing, and loss to follow up is okay, and not evaluated. You have all kinds of things. So one data is able to do it. So you can also download this. So you can export this data. You can even do that. You just have to get this copy. Then you can manage to do so. That is what I was mentioning. Let's go back to our thing. Does it make sense? Yes. So that's the data visualization. What about the clinical trials? Faster drug development through health data analytics. You need to have, so if you're developing a new drug, I think sometime back in the newspaper I read that cancer will be a past. The biggest killer after heart diseases, the cancer. and they are now developing a drug. So no more surgeries, nothing. Through the drug you can do it. Have that drug pass the clinical trials. That data will be useful here. So clinical trials data. A lot of them, all pharmaceutical companies will have that. India, Hyderabad has this, pharmaceutical industry. Majority of them are there. Then comes the genomics. Genomics is nothing but personalized medicine based on individual DNA makeup. Oh, this is the, I think, evolutionary process in terms of the treatment today. So your genetic or your individual DNA makeup is different, and hence personalized medicine is prescribed to you. Then there are also social factors. The social factors like analyzing the data on social determinants, especially your income group, education, awareness, where do you live, what kind of food that you eat. All these things are going to contribute a lot. So data is used by a lot of pharmaceutical companies. We know that pharmaceutical companies rely on empirical data. What is empirical data? What do you mean by empirical? This word? Empirical data. Anybody? So you can always go to, let's do something, pharma companies empirical data, databases of data, right? So they are doing it. I'm doing a Google search so that you're on the same page. So National Institute of Health will give you that, and then there are also companies which are there. Okay, so National Data Curation, Data Availability. Okay, so this is absolutely about that. Formats, the other formats, do they produce it? Let's look at it. But this is about the paper that they are talking about, not essentially the one that we are looking at. Okay, let's go back and check one more time. Databases in India. Okay, and we can say in Excel. Excel databases. So Department of Pharmaceutical has that. Let me just get this. Many of them are leading to this thing. So let me just go this. Yeah. So you have to extract from the annual report. Annual report are the rich sources of data. You can go back and look into it. Annexures that you have. Okay, overview. Mhm. Public sector undertaking, functions and others, largely an IPR. You also have an IPR Hyderabad as such. Okay, yeah. So this is the one that you get it. Export import. How many exports imports have happened? Look at this data that you are able to get it. It's a simple bar charts that you have. So and you are comparing 3 years. The exports have been more and imports have been less. That's a good news. More export, that means India is able to send more drugs outside the country. FDI flow, what kind of companies that are having foreign direct investment into the pharma and the medtech sector in terms of amount. And financial year, look at this one, flows, overall consumable surgical instrument, a lot of data, implants, IVD reagent, many. That goes on and on. Export data, top export destinations. So where are our drugs going actually? Where are they going? A lot of them are going to which country? US. Then, surprisingly, it's China, the second one. And third one is Germany, France, Singapore, UAE. Really important. And where are we getting or imported? UAE. So look at which companies are there. Cipla, of course, Polymedicure, LBM, Microlabs, all these companies. They have it. So you can get this easily. Annual reports are the sources of rich data. Remember this. These are filled with photographs, reports, everything. A lot of them. I mean, it has 180 pages report, but gives you a lot of things. How do you extract this data? Even the visuals are data. Those visuals. The one that I'm running through is also going to give you a lot of understanding. This is one part of it. Organizational chart, program interventions, all that. Okay, let's go back to our data usage. Right, so data analytics is an evolution in accessing the information and the data. Undoubtedly, that's true, and it holds true for majority of the cases. And historical trend of information dissemination since the printing, and you're able to download the uh, annual report 2022-2023 is because of the dissemination. All the big companies that you go and you can look into it. Let's do that for one more time. And one, yeah, let me, where is this? Okay, annual report. Yes, there you are. So I'm going to go to Cipla, right? Cipla Pharmaceutical Company, a leading global pharmaceutical company, is an Indian multinational corporation, right? And you will get that. Okay, so you have a media center, media releases is there. You can even get that. Look at this, has PDF documents here. You can download this and to get that. A few more can also be there. So you can also get the annual reports. See, this is for the investors. Okay, yeah, the corporate social responsibility data. Uh, Shareholding pattern. No, 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 no. Not this one. Data privacy, equal opportunity, dividend. This is largely about the businesses. Apart from the businesses, I'm trying to look at it. Do we have any other thing? Or the annual reports? Annual general reports. You have it. Look at it. Here is the one that you have it. A single page. You can get it. Okay. Let's study. So you force for good, pioneering, innovative, and rooted in care. If that is their slogan, this is what it is. Annual report. Now, how beautifully they made it. Can you make out something from this data? Revenue from operations, 5-year CHGR. You look at revenues up ex COVID, year on year growth is 5%. EBITDA, PAT margin, all this is. So if you have to invest into it, what kind of things you will have? Revenue contribution. These are people who are there on the board, independent directors. Okay, many of them are there. 10-year of revenue. Look at this one. So from 2014 to 2023, you got revenue. So profit has gone up, dividend has also gone up. The total equity. This is from the perspective of the businesses, but it's at a pharmaceutical company, right? Yeah. See that who is the founder, what has happened. all these things. So you should be able to go through that. It's a big document. Yeah, represented very nicely made. You can pick up Dr. Reddy's. You can even also go to Dr. Reddy's laboratory. I'm picking randomly. You're most welcome to pick up anything, and we may not be able to see that, and hence we are here to look at who you are, what you do, and yeah. So if they have launched Daily Bloom, India's first digital integrated care plan, right? They launches Neri Vivo in Europe, and Europe, it's a big deal for them. Look at this one. Our businesses, what are their businesses? If you look at it, their capacities, manufacturing and supply chain. Yeah, so this is widely talked about it. Nerivio, they entered into the UK market. Russia, of course, they have got it. Winner of the product of the year. You have that. A whole lot of them. They are there. You can easily get it. So for all the things, you can easily connect it. So we have seen it even for the investors. Let's look at it. You have reports and here's governors. Yeah, you will get it. The composition. Uh, Let me just go down. This is largely the financial information reports that you have. You are interested into it. Okay, and annual report. Yeah, this is it. You can have it. So every company like this, Dr. Reddy's, you have seen Cipla. This is Cipla's. This is Dr. Reddy's, and they are able to give you lots of details about it. Yeah, look at this one. Their key performance indicators that they have been able to achieve it. A whole lot of things. You see how their annual report is filled with visuals, photographs, and it's easy to go through. There is a lot of data also, comparative data as well. Look at this one. ESG aspiration and progress. That they all have good health can't wait. A nice slogan. Value creation model, how they have created values, patents, our patients' accessibility. Look at how many patients a patient reached through our products and services. Approximately 689 million. Wow. And they have this program called Sparsh, enhancing affordability of the medicine. So there is a 39% of the new launches were first to market. So every year they have this. Okay? 19 small molecules that they have there. Nice one. So this is about the patient, directly, indirectly, inclusivity, our people, staff, progress, employee communities, and how are they growing it, improving farmers' life because they have to procure it from the medicine. Medicine comes or the vaccination may be coming from the agriculture as well. All that governance, everything. This is just a gist of it. You can explore more and further. Let's move on. Okay. Yeah. So So big data also offers the great opportunities. What is big data? The data of the data. Like you have data sets, will monitor uh, huge. All these hospitals' data will be stored by, let us say, the National Medical Council. The National Medical Council has access to that big data. Some of the consulting firms like McKinsey estimated that it's going to be $100 billion annual in the healthcare system. Such a big, huge money. You can't imagine. 100 billion is really, really big amount. And there are also different ways of looking at data to reap the benefits. So how the pharmaceutical companies use the data, they use a lot of predictive sites, because if this year malaria is going to be hitting lakhs of people, they have to have vaccination or medicines available to them. And they're also going to look at the chronic diseases according to the population, health. And then how are they going to look at that 30-day hospital readmissions is another thing. And then also getting ahead of patient's deterioration. So even something goes wrong, they should be able to help you, right? If, things should not slip out of hand. Might happen in COVID, but if COVID again strikes back, and then these pharmaceutical companies have their um, firm ground to battle it out. Foretelling appointment of no-shows and preventing suicide, patient self-harm, all that is part of the pharmaceutical companies and all. So they also predict patient utilization pattern, how patients actually use and then manage the supply chain, which is a big thing. uh, the medicine is available, but it's not available in the medical stores. So there is a problem of the supply chain as well. You have a medicine, but it's not available in your neighborhood medical, yeah, shops. So the pharmaceutical companies are unable to manage their supply chain, and you have to have the strong data security also. There is no uh, breach of the security as far as their formula are concerned, their patents are concerned, and that's why they file for patents. And a lot of their funding actually goes into the patents. Why the drug has become costly? Because of the patents. uh, that's one. Then developing precision medicine and the new therapies, time and again with the changes, uh, be it resistance to change. The patient may not respond. Initially, there were a lot of responses, but later on, it may not. So those kind of details are also being taken care. So you invested millions of dollars in developing a medicine, and after a few years, that medicine is not going to be helpful, right? So that's the one. So you also need to bolster these patient engagement and also satisfaction, because if you can engage the patient and give the hope to the patient that the patient would be able to get discharged and go home, and even if they are at home, and they will be relieved from the suffering, and then they will be satisfied. So that's the idea behind it. So use of analytics is always there to improve the patient's services. Like, they play an important role in improving patient care, risk scoring for chronic diseases and population health. All that is there, isn't it? This is part of it, and that is why it is important to look into it. So, healthcare management information system (HMIS) is actually a module that will leverage the data from the improved healthcare delivery. So HMIS is going to involve data collection, information, knowledge, and also improve the healthcare services for the better patient outcomes. And overall, the data analytics also involves analyzing the data, not just collecting the data, but analyzing it. Whereas the informatics applies the insights that you gain from the analysis. So, what interpretation that you have from the analysis, that will be the key in the informatics area. So, health management requires monitoring of the population health, service provision, drug stock. You have to have this checks and balances. You should know the majority of the population suffering from which disease. Are you equipped? Do you have the provision? Do you have the number of beds? That was during the COVID times, or during the pandemic, it was shaken, right? For the first time, we felt that we don't have enough infrastructure. And then the drug stocks, equipment availability, finances, personal, all that is part of it. Okay, and then timely and accurate information is the key for recognizing the weaknesses and improving the service delivery. Overall, this information system is necessary for managerial improvement. Without the database HMIS, it is difficult. Somebody is joining. Okay, let me just go there. I heard the sound. Yeah, I'll add it. Add it. Okay, there we are. Where are we? Yes, we are here somewhere. Yes. Okay, so effective information systems are quite necessary for your managerial implement and so on. HMIS or HIS or HMIS, they are used interchangeably, but uh, HIS actually uses the record, stores, retrieves. It's not just information storage, but also information retrieval, and based on that, you take the decision. Decision making would include managerial aspects and patient care, training, research, development, all that. And then you need to have a lot of technology, especially the computing technology advancement, and should be able to enable the web based systems also. So public health management has been slow. Yeah, so if you happen to go to public healthcare centers, then HIS is very minimal. They are still in that manual thing. They're not much there. So computerized technology can actually improve the policy and also planning, and then it also helps in resource location, resource allocation. So HIS is healthy because HIS will generate information for the decision makers. It can also serve at different levels, different purposes, including the various sources, all those things, and then the data quality, representation, all that is part of the decision making. So it's overall uh, need to have the ministries of health, national statistics offices, international agencies, all of them are able to provide you the availability of the data and the quality of the data. So the availability and the quality of the data is the key in providing the right kind of medical information. So trends in HMIS is that it has to be cost effective and should be able to solve the accessibility issues. Response times also. It should not take more time, or patient convenience should be taken into consideration and should be free from the errors. So overall, the final word is healthcare analytics is revolutionizing the healthcare industry, and it's there to provide natural patient outcomes, optimizing treatment plans, enhancing public health policies, and so on. The data analytics offers immense values to not just hospitals but also to the pharmaceutical companies. There are lots of opportunities as far as innovation is concerned, and in turn, that will improve the patient services, and it will continue to transform the healthcare industry. All right, so this is what we have. Any other questions that you have? Please let me